Hi, everyone. Thank you for being with us this evening. My name is Alexis Hall. I'm a volunteer with the Life and Breath Foundation. Thanks for joining us for the Sarcoidosis Q&A with Dr. Mark Lamos. Before we get started, I'd like to share some information about the foundation. So again, my name is Alexis Hall, volunteer with the Life and Breath Foundation. Our primary goals of the foundation are to offer the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize their quality of life. Also to provide a nurturing environment for those who are affected by sarcoidosis and allow them the opportunity to share their experiences. Additionally, to build more awareness within the medical community to help combat this chronic disease. And what we do to support the mission, we're a volunteer-led organization. So the money that we receive through donations and sponsorships goes directly towards supporting patients that have sarcoidosis. We do this through the monthly speaker series, like what we're doing this evening. You can find our replays available on the YouTube. And also we have a physician education component. That's our Life and Breath Scholar program. We offer patient support with our sarcoid experts, as well as through sponsorships and education programs. And we have a My Life and Breath planner available on our website that I hope you'll check out. So our next event that we're excited to share is our Take a Breath for Sarcoidosis 2024. We have a live event that will be at Dijon Vineyard in Heights, Maryland on April 14th, 2024 at 10 a.m. There's also a virtual component. So if you're not local to the Maryland area, you can join us virtually, you and your families. You'll receive a shirt as well as a brace medal. If you're in person, we'll have a fun wine tasting. So we hope that you'll join us. Now today we're here with Dr. Mark Lamos, who's one of our board members at the Life and Breath Foundation. He's the Vice Chief of the Department of Medicine at Greater Baltimore Medical Center. And in the past, he's held multiple positions throughout the hospital. He's cared for over hundreds of patients with sarcoidosis. He's helped them manage their complex care. And he focused on patients that require coordination between primary care, specialists, and other healthcare services to better manage what are usually serious and very chronic pre-existing conditions. Dr. Mark Lamos, we're happy to have you with us here today. And before I turn it over to you, I want to remind everyone of this brief disclaimer. This webinar will not give medical advice. No doctor-patient relationship has been established by talking with Dr. Lamos during this meeting. Our speaker does not know your specific medical background and can therefore not give you any specific medical advice. Please speak with your doctor before acting on any of the information you hear this evening. Again, thank you all for being with us, and I'll turn it over to you, Dr. Lamos.
Well, thank you very much. You know, I appreciate coming to speak with you. This is one of many of the times I've had a chance to speak to this through this wonderful organization, and it's been a help for many, many people. You know, what I think is a good starting point is if I can give everyone a general overview of sarcoidosis so that we have a common group of information, and that way when I answer things, it might make better sense, because I had a chance to peruse the questions that people have submitted, and I think it would be helpful if we just start at the basics, and I'll do it very quickly. Sarcoidosis has been a diagnosis that's been around for a long time. It goes back to a period of time where it was descriptive, and it was simply described as a group of cells that were all bunched together that caused a firm, hard nodule in multiple tissues. Over a period of years, it's now grown to a part where it describes itself as an immunologic disease that causes the immune system to try to attack an unknown threat to the person, and the immune system tries to wall off whatever that is causing the problem. and it can occur in virtually any tissue in the body. And the majority of people that are diagnosed with sarcoidosis are diagnosed because of something that they don't even know they had. It's a chest x-ray for a preoperative exam, or somebody thought they had COVID and they were coughing and they did a chest x-ray to see, if they had pneumonia, and they saw a bunch of lymph nodes. And oh my God, the world just set off on a thing, and somebody talks about cancer and blah, 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 blah. It just races down this street. And as it turns out, sarcoidosis, can be diagnosed at ages that start in the early teens and goes to the 80s. The majority of people get it are diagnosed in midlife, but that doesn't mean that's when it started. Frequently, the abnormalities that raise sarcoidosis questions, if one goes back in the record, you can find them. The average person with sarcoidosis is diagnosed after a couple of years of not knowing what's really wrong with someone. And it can present itself literally with eye disease, hearing disabilities, chronic renal failure. It can present with all these horrible diseases, but frankly, the nice thing about sarcoid for many people is that 50% get better with no treatment whatsoever. Their disease that they found on that chest x-ray melts away after 4 to 6 months. Another percentage of them that doesn't necessarily melt away or develop symptoms are treated with steroids, with or without a drug like methotrexate. And then a very small percentage of people end up having this really recalcitrant disease that requires biologic agents, aggressive treatment, and a very, very small percentage of people develop multiple organ involvement with organ failure. And, all the ones that, I'm sure if you've been reading about sarcoid, probably scares the whippy out of you. But the truth of it is, it's a very small percentage of people. And if you can keep that in your mind as you go through your personal journey with sarcoid, it will help. What I would remind everyone is that sarcoidosis, because it's hard to diagnose, may have been present for a while, and it has to be thought of in the context of what other diseases or other problems a person might have. As people age, and if you think about it, a lot of people in midlife don't seek out that much medical care, and all of a sudden they hit this 50-year-old birthday and they get this gigantic urge to say, I'm going to get healthy and I want to live forever and I want to do X, 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 and X. And then all of a sudden they find a few abnormalities and we go on this hunt. I just want you to kind of let those thoughts meander in your mind as we go through all of these questions, because some of these questions are for people that may have the more severe forms of sarcoid and not the run-of-the-mill, the one that is mostly an aggravation to life and not necessarily life disabling and destroying. Okay, so I'm ready. Alexis, what's the first question?
And I'll remind everyone that you could submit your questions in the Q&A as well. We look forward to hearing from you. But the first pre-submitted question is from someone that's newly diagnosed, and this individual wants to know how they can learn more about sarcoidosis and how to live with it as a newly diagnosed patient.
It's a great question. We're lucky enough to have a bunch of really good websites. There is a website, just our own website, frankly, has a whole lot of things in it that's really excellent. If Abigail, we still have those first parts I made years ago. Yeah. Okay, there's a concise, much of what you heard me in the preamble to this, you will find familiar when you look in our website. But there are a bunch of other good sources. Sarcoidosis.com has good information. ClevelandClinic.com has excellent information. I would caution you to take, to not go out on some weird direction, because you want to always use evidence-based medicine with this disease. This is not the one where you should be making decisions based on any kind of hearsay or uncertainty, because you can make mistakes that could hurt people. But to simplify your answer, clevelandclinic.com is excellent, sarcoidosis.com is excellent, and I don't think you'll find fault with our own website. There's a ton of information. Did I cover that question?
Yes, thank
All
you.
right. How about the next one then?
And similar to that question, it was a little bit of a follow-up. Is there anything that can be done to reduce the speed of progression or to reduce flare-ups of the disease?
Okay. Well, I wish I could answer that one succinctly. Flare-ups occur when a person's immune system is stimulated. We learned during COVID that some people with sarcoidosis had flares occur when they had a systemic vascular response to the disease. So I guess the best answer is try to stay as healthy as you possibly can. And if you get sick, you need to make sure that you're aggressively treated. And part of your treatment of the disorders that come up nowadays would include something that is anti-inflammatory. I'm not advocating prednisone, but what I am saying is low dose aspirin has been found to be of some benefit. And there is good evidence to say that these patients with sarcoid should consider that. In general, aspirin therapy has fallen out of favor for a lot of diseases, especially in women. It's been found still to be somewhat useful in men if you've had heart disease, but it's not really as suggested for as many things as it once was. But the question for a sarcoid patient, you want to reduce anything that causes inflammation. Herein, I think I read somewhere in one of the other questions, somebody says what we could do. Eat an anti-inflammatory diet, fruits, vegetables, not as much red meats, the same stuff you've been hearing forever, a Mediterranean style diet, all excellent thoughts when you're considering you want to reduce generalized inflammation. Okay.
That was one of the questions about dietary recommendations. They also asked about supplements.
Well, I'll probably be shot by the supplement suppliers. I'm not, I'm a great believer that says eating healthfully, adequate exercise, enough sunlight so that your vitamin D is up. I'm not a great person for pushing all the vitamin D supplements and tons of vitamins and blah, blah, blah. So I'm going to look at you and tell you, I think every one of us knows what a healthful diet is. It's been talked about forever. I think we also know that if you don't eat that, a multivitamin is a reasonable thing with enough vitamin D so that, and we're going to push for going outside and a little fresh air is a good idea. And I'm going to look at you and tell you, I don't know of anything specifically that I can tell anyone that's magical about a diet or the foods they eat. I can tell you getting an adequate amount of sleep. I can tell you that, taking care of all your other medical problems as they go on. If you're diabetic or hypertensive or you have mild chronic renal insufficiency, please take care of everything else. Don't focus your life only on sarcoid. You have to look at yourself in its total. Please manage all the disorders that you've come up with, because they all end up having an impact on the inflammatory state and the potential for having other things go on.
Thank you. Let's see. How do I look for a doctor who is knowledgeable in sarcoidosis?
Well, I think you got the idea already that the first part of it is getting an idea of what your personal disease is like. It just made me think of something I need to say. If someone tells you that you have stage 4 sarcoid, it is not the kind of cancer term. Do not mix them up. Stage 4 sarcoidosis just suggests the involvement of lungs and other things. It is not stage 4, I'm going to the ground next week. No, do not even let that cross your mind, okay? Okay, where do you find an adequate specialist? This is the kind of care, if you have multi-system disease and a whole bunch of things wrong, you really got to use a sarcoid clinic. If you have major pulmonary involvement, you would find this most likely in a university-based system or a larger system that has pulmonologists. And most modern trained pulmonologists have a good background in what to do. But remember, they're lung doctors, and this disease can literally affect all systems. You're not going to find one individual who spent his whole life doing nothing but sarcoid. I come as close as anybody to have taken care of a large number of sarcoid. Most docs will tell you they've had 1 or 2 cases. I don't know, lucky or unlucky that you might call me. I probably have 300 or 400 over the years and talked to many more than that, but that's not the norm. The norm is multi-specialty care. They all have to be communicating with one another. If they have a good electronic medical record system that they can share data together, goes a long way. If you happen to have access to a system that uses Epic, it's made to be able to do this kind of care with someone with chronic illnesses. There's a thing called a care team. So whenever you do a lab, it shows up in the other guy's inbox when, those kinds of things. That's what you're looking for. If you have not critically ill sarcoid and you find it on a chest x-ray, a well-trained modern internist can help you get through the first stages. But if you have a lot of these other things that are other organ involvement, you really should use a sarcoid clinic type thing. Where are they? Our website has that information available to you. We have centers of excellence across the entire United States. If you happen to be calling from Europe, there are several good ones in the UK. There's University of Padua in Italy has a very excellent program. And you will find that, there are, if you end up having to find one and you're outside of the United States, if you drop a note to Abigail or Alexis, I'll help you find a center in your country or close by. But you don't have to go, 2,000 miles in the United States, pretty much within 100 miles of just about everywhere, unless you live in Montana, in the boondocks somewhere, you can find good care. Our tool that you use that you can carry with you is the secret for you to bring care if your system doesn't use an electronic medical record effectively. Take a good look at that tool to allow yourself to carry with you your medical records about sarcoid, and it'll teach you very well how to be able to talk to the doctor. And if he doesn't know what he's doing, I'm going to suggest that you need to learn how to figure out some of the stuff and know some of the language that you're going to need for communication. It's not that hard. We've put all of the data in this website so that you can do it. If you run into specific problems, bug Abby and I'll do my best to help you. Okay.
Thanks for mentioning that. That's the planner. So the free planner is on our website. Please check that out. So we got a question about does an individual still have sarcoidosis even if they're in remission?
Yes, because the truth of the matter is we don't know why you got it to begin with. I can give you a bunch of stories, okay, but I can tell you that if we really understood what started the whole disease, we would do a lot better on knowing what to shut it off. We know how to limit its inflammation. We know how to stop some of the damage the immune system is doing to your other organs. Do you ever really clear sarcoid? Yes, I've had some people that I think have been free of disease for 15 years, but I would never say to that person that you're totally cleared. I think I prefer the term that you're in remission and you need to still be followed carefully. And the kinds of things you follow up with are any change from your basic health. You still need to go for your annualized exam. You're going to need your basic blood panels. You're going to need a urine to look for protein in blood. You're going to need to go see the eye doctor to make sure you didn't develop uveitis or glaucoma in your eyes. You know, you're going to need to look at your skin that you don't have something growing somewhere that you shouldn't have. And remember, this thing can occur in places that are not so easily seen. So I guess what I'm telling you, as much as you may not want to have real exams, this is not virtual medical care you need. You need to be seen, and somebody's got to look in all those places the sun doesn't shine, you know. Okay, next one.
Thank you. You mentioned prednisone earlier. There were a couple questions about it, specifically getting off prednisone.
Mhm.
What do you do if you have a hard time getting off prednisone? And are there any other options other than prednisone?
Well, it depends where in the stage of your diseases. If it's freshly diagnosed, especially in the first year of a person's course, prednisone remains first line therapy. It least side effects, least potential for damage. Is it a great drug? Boy, it helps a lot. Does it have trouble? Yes, it causes trouble with diabetes. It can cause you trouble with your joints. It can cause a lot of issues, but it's the dosing that is got to be considered. You must take enough so that you control the inflammation at the beginning. If you a term you might want to know is it's about a half a milligram per kilogram to start. Sometimes you have to go up to as much as a milligram per kilogram. For most people, that means 40 to 60 milligrams at the beginning per day. Okay, and then it's got to be reduced. If you're a little binky person, it's a lot less than that, but you still got to get enough to control the disease. Okay, and then when it comes time, you first got to say, is my disease now stable? Am I free of symptoms? Do I have anything bother me? Note, I did not say that your chest x-ray went to normal. Note, I did not tell you that the abnormality they saw in your liver is no longer present. If there is no longer any enlargement, no other enzyme abnormalities, nothing else, most people attempt to wean the drugs. If it were to fail, then you add a drug like methotrexate. What does methotrexate do? It limits your steroid dose. If you had to stay on 40 to 60 milligrams for 6 months, you'd gain a bunch of weight. Your face wouldn't look right. You'd have a funny looking hump on the back of your neck from what the steroids do. Methotrexate does a great job. You can reduce the dose by probably 2/3. It all depends which organ systems are involved and how far you push prednisone before you make the switch over to a biologic agent. The biologic agents are really the newest thing coming out. What I would look at you is I find a difficult time finding anything good to say about COVID or any vaccines. But frankly, the mRNA viruses has given us a great tool to be able to find not only treatment, but potential diagnostic tools and otherwise. The drugs that I have a bunch of letters in front that look like too many vowels ending in NAB, okay, are the classic biologic drugs. And there are a million of them. No, probably I should say 100 of them, but it feels like a million when I got to try to keep them straight. But the long and short of it is, the biologic agents are the mainstay of disease that doesn't want to respond to prednisone and methotrexate. They are great drugs. They work incredibly well. I've seen them work when we couldn't make one bit of difference. They are drugs of choice for the ones that involve things like the central nervous system. Frequently, they're used in people who have really difficult disease in their kidneys and otherwise. Those require specialist thought because literally there are papers being published every month giving insight as to which drugs are best, and there are great big differences between them. That's why I push you for the idea of a sarcoid clinic. which goes back to several questions ago. No one person is going to be 100% expert in which of these drugs are going to do the best job. All righty, what's next?
Dr. Lamos, is it possible to have sarcoidosis active in one area, such as neuro, for example, but quiet in other systems?
Yeah, it's the norm. Most of the time, people, yeah, we find it all the time where we only find it in one system. I've seen people diagnosed with depressive disorders. I've seen them diagnosed with seizure disorders, and it ends up being just sarcoid. I don't mean just sarcoid. Sarcoid is bad, but I've seen them crazy diagnosis entertained when it was a treatable cause. Yes, you can get it in the skin. You can get it in the eyes alone, where you get a red eye that doesn't get better after what they thought was something simple. I've seen it, chronic renal failure occur from it. There have been heart attacks that cause our sarcoid. There are people who develop congestive heart failures from it, and that's the only place they have the sarcoid that we can find. Yes, the simple answer, yes, you can have it in a single organ system. Multiple organ systems involvement is the rarity, not the norm. Pulmonary is overwhelmingly the most common.
Someone mentioned in the chat that they feel like sarcoid is like a whack-a-mole, and sounds like a great synopsis of some of your comments. There was a question about peripheral neuropathy and if that only affects the hands or if it can affect other areas.
Okay. There are almost 200 or more known causes of peripheral neuropathy. Can you imagine the first thing before you blame it on sarcoid, if that's the only thing you have, okay, you make certain that somebody looked and went through the effort to make sure that it wasn't diabetic. You make sure that it wasn't, there are many forms of peripheral neuropathy. You really have to go through it. And a neurologist has a regular checklist. I have to do it by checklist when I'm in the office because there are so many things that have to be thought of. You can't just, you can't just be some gray-haired old guy who sits at the computer and checks a bunch of blood tests and says, yes, I know what's wrong with you, ma'am, or your child or whatever. It doesn't work that way. You've got to really dot the I's and cross the T's. And when you've excluded everything else, then and only then, and you generally have to take a hunk of a nerve. It's usually the sural nerve in the back of your leg that is checked. Then you find granulomas there, and you've done all the things you're supposed to do, then you blame it on sarcoid. Does it respond to treatment? Usually not 100%, but it improves.
Thank you. What about blurry vision? Can anything be done for somebody that's struggling with blurry vision with sarcoidosis?
Okay, kind of what you just heard the story about peripheral neuropathy. Your eye doctor has to really make certain that you know why. Because blurry vision can be from the lens, it can be from the cornea on the outside, it can be a retinal disease, it can be a macular disease, it can be literally, I can think of at least 10 or 12 different disorders, starting from the lens on the outside, going all the way back. If you've gone through all of those and they are certain that this is sarcoid causing it, there are treatments that are done. Just be very certain that it is the sarcoid causing the blurred vision and the abnormalities, and that it's not an intrinsic disorder of the eye. And the answer is yes, there is treatment. Go to a university-based program for disease. We have a great one in Baltimore. It's called Wilmer. It's with Hopkins. We have an equally good one in places, literally in the United States. You have many places that you have adequate folks there. St. Louis has great folks. Cleveland has great folks. You got people up at Mayo. If it's your eyes you're talking about and you're concerned about blindness, you need to go get the right care at the beginning. You may not have it in your own communities. If you're in Almont, Colorado, and you're a million miles away from someplace, you may have to take a ride to Denver to get what you need, but you can get it done.
I have a feeling there
What,
might be
what you heard me say again was you got to better be sure it's sarcoid. If it's sarcoid, there is treatment available, but be positive. Be absolutely positive, because if you miss the treatable causes that the other diseases are, it won't matter. And a lot of the other, if you let those diseases progress, you'll lose your sight, ma'am. Okay.
Thank you. And this might bring a similar answer, a similar response, but this was asked a couple times. So can pulmonary sarcoidosis cause pain in my joints and feet? And someone also tied in a similar question about arthritis. Is there a link to sarcoidosis?
Absolutely. Absolutely, sarcoid can cause an arthritic disease. For all the world, people have been confusing it for years and calling it rheumatoid arthritis. They've called it psoriatic arthritis. They've called it all kinds of things. And interestingly enough, some of the treatments that they use for those disease also end up being effective for the joint disease associated with sarcoid. But these are the biologic treatments. If it is from sarcoid and you get a whapping dose of steroids that somebody gave me, you should have noticed an improvement in your symptoms. If it didn't improve with a steroid dose that somebody, I'm sure, would have given you, look to make sure that it is really sarcoid related. On our website, we also have rheumatologists that have familiarity with the disease. It is a common complaint that is often part of multi-system disease. All right.
Thank
Did
you.
I answer it, Alexis?
Yes, you did.
Next one then.
New studies show that plastic in our products and water cause a change in our DNA. Could that cause sarcoid? Could something in the air also change our DNA to cause sarcoid? Is anyone doing studies on pollution and contaminants with sarcoid?
Well, I think everyone is still hunting for an understanding. Because if you remember, I told you that some of these can be confused with is beryllium. The way this was found was people that worked in a foundry and they were being contaminated and inhaling stuff, and lo and behold, they developed granulomas. So is that an environmental contaminant? Absolutely. Do they do this in China? They do a lot of heavy mining for the stuff that they make batteries for automobiles with and that type of stuff. They have an enormous number of people that the diagnosis of sarcoid was made. We don't know how good a job they went through the steps to prove it. Yes, they are looking for an answer as to just what it is. I think that what we're going to find out is that you inherit in some people a predisposition for inflammatory diseases. And then if you're unlucky enough to have gotten either a bacterial infection, viral infection, some exposure in the environment that your own DNA or your own immune system doesn't know how to handle or can't eliminate, it goes on a binge to try to attack it, and lo and behold, you end up with sarcoid. So to answer your question simply, the answer is they're trying really hard, but it's so far no really good answer. I saw a note pop up from somebody or another that you live near a foundry. This was rather specific to beryllium. It's not commonly done in our country. It's in a lot of other places, where they've massively polluted areas, in Brazil. They've massively polluted places in China where they're rebuilding batteries and stuff like that. So if you're near a place where they might be tearing apart old ships, or they're taking materials and attempting to reprocess them, and they're not doing it in a healthful way. There's, that needs to be considered, certainly. But remember, then, if you get these granulomas and they're due to other causes, what I would tell you is that it's not sarcoid. Then you have a disorder or a disease associated with a contaminant. Sarcoid is in many ways descriptive of what they see, but we tend to think of it that it is even more than that in this country because we don't have a lot of the exposures that you might get elsewhere.
Very interesting. Thank you. Have you seen any cases where sarcoidosis patients experience chemical sensitivities, i.e. the dosage amount of prescribed medications and over-the-counter supplements causing side effects?
Well, it's a hard one to answer. I've often wondered if some of the supplements that people take, especially some of the herbal compounds, since we have no idea what's really in them or how well they were, processed. If you don't look at the totality of an individual's medical history, it's difficult to blame any one thing. Have I seen people who I thought might have had interactions? Certainly. That's why I try to tell people stick to evidence-based medicine as much as you can. I tend not to walk down the road of homeopathic treatments, and I have my own, and I have a difference of opinion, and I'm sure that if you go through our website, there's another one of us that has a strong belief that's pretty much opposite direction. But we work together in the sense that as long as whatever the homeopathic treatments and whatever the supplemental things that people want to try don't have any downside, why not? Do what you want. I'm not sure that that's not necessarily how I do it, but I could certainly see that that's a reasonable approach, and people should approach their disease in a manner that they feel most comfortable about.
Food for thought. How often should you get a CAT scan to monitor sarcoidosis in the lungs?
Well, if you're looking to see new lesions, or if you're thinking you have worsening shortness of breath, if it was diagnosed by lymphadenopathy, and then they do a CT scan and they're looking and they scared you with the potential of it being lymphoma or lung cancer or blah 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 blah, you need to have it often enough to know that it's not progressing and to be certain that you don't have a second disease. I'm not certain that there's a set schedule. If your disease is clearly getting better, it's not uncommon to have people get their studies as a plain x-ray. I think you need to be aware that a single chest CAT scan with contrast is, depending upon the machine, has the equivalent radiation of between 200 and 400 chest x-rays. If you have multiple CT scans, you may be giving yourself your cancer that's going to come down the line. You should be very thoughtful about the number. And the doctor who's ordering them should be keeping track of the number of studies that you have. You should not be doing a bunch of x-rays unless you have a clear-cut plan for what you're going to do with the data. CAT scans especially, CAT scans are a lot of radiation. And unless you have a good reason for doing multiple follow-ups, in the early days, I used to see people that would have anywhere from 12 to 20 CAT scans over 10 years. Now that I've been around doing this long enough and I see that they've come down with other diseases, I'm not sure that we weren't part of the problem. You should be asking them, how many studies have we had? Are we going to use it for any one thing in particular? Are you sure this one is necessary? Because I really don't want to be irradiated by my medical profession for something that I don't necessarily need. That's that.
There was a follow-up question to the discussion in sarcoid of the eye. And this individual wanted to know if there was a particular test that would separate out other conditions from sarcoid.
Well, most sarcoid of the eye is noted with what's called iritis. It's a redness of the eye, and when they look with a slit lamp, they look and they can actually see the granulomas with the. There are fancy studies that are done, but they're all done at medical centers that are focused upon these kinds of diseases. It's not stuff that your local ophthalmologist is going to have available. But it is with a quite honestly, it is a specialized group of tests. The guys that eye doctors are split up into a couple different pieces. They look at one group of guys does the front part of the eyes with the lens, iris, and cornea. That's called the anterior chamber. Then you have another group of people that do posterior chamber. That's the one that have the retina. They're the ones that put your retina back in place when it detaches. The one where if you were struck on the side of the head that you know, something separated, they had to use a bubble to put it back in. There's no one ophthalmologist who does all of these things. This is not like a study. If you have sarcoid of the eye, you need to have the person who does the disease properly. It's not just putting a few steroid drops in your eye and it gets better. It requires more specialized care.
Follow up to that, there's a question on if eye sarcoid can spread to other organs, just like other aspects of sarcoid.
It doesn't, the way you're describing it, you know, you're using the words that are like cancer, you know, did it start one place and if I'm not careful, it'll grow into somewhere else, etc. Immune diseases are present everywhere in your body. We don't know why they affect individual organ systems. Why are they preferentially going to your heart? Why are they preferentially causing you trouble with your kidneys or your eyes? We really don't know. I think the best answer that I gave earlier was whatever set up and started an inflammatory process in that organ system is likely to be the cause of the likelihood of that organ being involved with sarcoid after you've had it some other time. Often when we make the diagnosis of multi-system disease, it seems like it's a progression. It acts like a cancer where, you know, it started out just in the lungs and then, oh, cripe, we found it now in the liver and, oh, crying out loud, my kidney function is deteriorating normal. What you're really seeing is the effects of the inflammatory process everywhere in your body. That's the guy. You really need the specialist, and they're going to take a team of people. It isn't going to be one. You don't have one person that is going to be able to manage the kidney, the lung, the heart, the blah, blah, blah. The heart guy may have to do, if it ends up being heart disease, you know, it can affect the pleura on the outside of the heart. It can affect the muscle of the heart, so the pump doesn't work. It can affect the blood vessels as they leave the heart. So there's a whole bunch of things. Yeah.
There was a
Probably not
question.
a satisfactory answer, but that's as close as I can get for you.
I appreciate that, Dr. Lamus. There was a question about teeth, one that I haven't seen before. Do you know any connection between sarcoidosis affecting teeth or the mouth?
Well, not specifically. I wish the person, maybe they can send you an answer. If we're talking about teeth loosening and the jaw becoming osteoporotic, and if we're talking about those kinds of disorders, I haven't ever been able to isolate and say that it's specifically from sarcoid, but I have no doubt that you can get sarcoid in the bones of the jaw. I have seen it in facial bones before. I've seen it in sinuses. Much to my surprise, I saw a person who had tissue removed from a sinus that they thought was just a chronic sinus infection that came out and was sarcoid. So I can conceive of how that could be, but I think the majority of the time you would see it in the setting of an osteoporotic problem.
And they did have a follow-up question about treatment for sarcoidosis of the face, so it sounds similar to what you're speaking of.
Yeah. I'm not sure how to answer you better than that, because even in with my experience, I haven't seen somebody specifically with teeth, and the closest I have come to having it really being part of the facial bones has been that person that, much to my surprise, had sarcoid and residual tissue of the sinus. I now look for it more than I did before, but I have only seen the one. It's not common.
Thank you. You kind of went over this in your overview, but there's an individual here with us asking about the life expectancy for sarcoidosis. Wondering if you could briefly just touch on the cidos.
Sure. The majority of people live out and pass away from other causes, God forbid. If you're unlucky enough to have multi-system disease that is not responding to the biologic agents and all the things we're having, this is a terrible disease to have. It is capable of taking your life and sometimes causing organ transplantation, because sometimes the lungs are so spoiled, or your liver is so spoiled, or your kidneys stop functioning. But this is distinctly uncommon.
Thank you.
Uncommon. Period. Thank goodness. Thank goodness.
There's a question about sarcoidosis in the abdomen. What would symptoms look like if there was sarcoidosis present there?
Well, the more common places where it becomes found and it becomes localized in the liver frequently. And when they're doing this, look everywhere it might be involved. Somebody, I'm sure, will raise the question about PET scanning and all kinds of things. All a PET scan does is tell you wherever there is a inflammatory process going on in the body, it'll light up in that area. Sometimes it makes you want to look where there's inflammation if it was in a specific joint. But remember, it's non-specific. A PET scan lights up wherever there's inflammation. It'll light up if you had an infected joint. It'll light up if you had an isolated lesion for another cause. I don't advocate PET scans on every person that has sarcoid. If somebody has multi-system disease, yeah, sometimes I suggest they do it. Sometimes the team of people that are responsible for taking care of them feel like, oh my God, where else could it be? You do it, but you usually use a degree of medical intuition by saying, where are your symptoms? Where have we found a problem? Do we find it on examination? Do we find it in your laboratory work? Do you have other complaints? Usually we try not to over image people for the reasons I told you. Most of the imaging has a downside.
There was a follow-up question on that as well, about if it's only CAT scans that have a downside, but also MRIs and other imaging.
Well, MRIs don't have the radiation issue, but they're better for soft tissue than others. MRIs seem to be used for a million other reasons. Remember, we use them for any place we can't explain it and the person still has a complaint in a specific localized area. We tend to order the test, and I hope that the majority of the doctors say, I don't know what's going on here, and I'm going to do this study. Where it does the best good for people are when they have an unclear orthopedic complaint that is distributed in either a distribution of a peripheral nerve, or if it's central nervous system and you can't really explain whatever the symptoms you have by your neurologic exam and a good good thought process. Yeah, we do it, but they're rarely the mechanism that is the sole way you make the diagnosis. Sometimes for neuropsych, you haven't brought it up, but I'm sure somebody is going to say, do you have to stick a needle in somebody's back to make the diagnosis of neurosarcoid? Frequently, you got to take fluid to see if you find inflammatory cells or you find inflammatory markers within the cerebrospinal fluid. But when you do that, you're also going to do a TB skin test. You're going to do a bunch of other things with that fluid. You don't want to be really embarrassed and find out the person has multiple sclerosis and you thought this was all sarcoid. And believe me, I've seen that before too. So you got to go through I know I'm preaching, but the truth of the matter is you got to have enough people and you got to have an approach to the disease that minimizes the likelihood of mistakes.
Thank you. You went right into another question. I appreciate you tying that in about neuro.
Oh, I didn't. There's one coming? Okay, let her
No,
rip.
there was. No, you answered it. But there's a question about kidney stones and kind of the frequency. What is the connection between kidney stones and sarcoid? There was a follow-up on if it's connected to medicine or the disease.
Well, kidney stones can be caused by so many different things. We tend to group them by the types of stones being formed. And if you remember when we started this whole thing, I told you that sometimes the diagnosis is only made because we have an elevated calcium that we couldn't explain. Once in a while, the granulomas are known to affect the way calcium metabolism occurs in the body. Yes, there is a association, but it's not as clear one-to-one. Not every person who gets sarcoid gets kidney stones. So if you have kidney stones and your calcium is elevated, they should be thinking, is there a possibility I have sarcoid? They should be able to answer that one pretty easily, and most nephrologists are pretty aware of that relationship. That's not a primary care doc's kind of problem, just so you're aware.
Back to the find your specialist. Thank you.
Yeah, I'm sorry to say it. Sometimes, if we maybe CHBT someday will be a better tool, but at present it is not adequate. So please don't use that as your sole medical advice. It does not work well enough yet. Okay. What's next?
So I'm interested in the prevalence of migraines with sarcoidosis. Could you speak about migraines and sarcoid?
Well, migraines are present in 20% of the population. It's pretty hard to make a one-to-one relationship, but have I had people with sarcoid get migraines? Certainly. Just make sure that somebody's not confusing a migraine with neurosarcoid. Usually that's fairly easy to put together. They have a history that starts before the disease ever was diagnosed. They have, a visual aura. The way it's taken care of, their response to treatment are usually all things that are pretty much able to differentiate the disease, neurosarcoid from central nervous system, sarcoid from just plain old garden variety migraines. It sounds like I put off the answer, and in many ways I just did. Migraines are a whole discussion. We could spend an hour talking about migraines, and we wouldn't have, we have just scratched the surface.
Right, and we talked about a lot of symptoms, that can have a lot of reasons behind it. Central theme today. We still have many questions that came in the chat, so we won't be able to get to all of the questions this evening. But I wanted to make sure everyone knows that you can send your questions to Abigail at lifeandbreath.org. She just put it in our live chat. But please reach out to us, and Dr. Lamos generously will answer questions as he has the availability to, and we can point you to resources at Life and Breath. But just wanted to pause for a moment before we end this evening and see, Dr. Lamos, if you had any closing words for us.
Well, I guess the best answer is be safe, happy, healthy, and please enjoy your lives as much as you can. That's the biggest thing I can suggest for people. This disease with good care can be taken care of overwhelmingly for most people. But think about the things I said. I'll be glad to try to answer your questions. But, we run into a problem because I can't supply one-on-one care to individuals. I'll probably have to, in some of them, just point you to a good resource, because if I focus it to one individual, it's as though I'm supplying one-on-one care, and I can't do that. So I wish you all the best. Please have great lives. Okay.
Thank you, Dr. Lamos, and thank you all for being here with us this evening. We appreciate you joining and hope that you'll join us next month for our next speaker series. Also, please don't forget to check out our run walk that's on our website, and we look forward to seeing you next time. Have a great evening, everyone.
Okay, take care.